The government shutdown fight is in full swing, and Republicans are looking for a way to reframe the conversation. Why? Because the Democrats' main demand, extending enhanced Obamacare subsidies, is proving to be surprisingly popular. Even many conservative voters support it. So, Republican leaders are shifting the narrative away from healthcare affordability and toward a more politically comfortable topic: immigration. They've begun repeating a now familiar claim that Democrats are trying to give government-funded healthcare to undocumented immigrants. It's a bold accusation, but is it true? Not exactly. The Democrats' proposal does not directly provide healthcare coverage to undocumented immigrants. Under current federal law, undocumented individuals are not eligible for Medicaid or Obamacare plans. That isn't changing. Nothing in the proposed shutdown-ending deal changes that. So, the idea that Democrats are pushing to ensure undocumented immigrants through this legislation simply doesn't hold up. That said, there is a small kernel of truth that Republicans are using to build their argument, and it centers around emergency medical care. Under a law passed in 1986 and signed by Republican President Ronald Reagan, hospitals that accept Medicare funding are required to treat anyone who walks into the emergency room, regardless of insurance status or immigration status. This is the Emergency Medical Treatment and Labor Act, or EMTALA. In emergency situations, the federal government reimburses hospitals for some of the care provided to undocumented patients. Vice President JD Vance highlighted this in a recent briefing, arguing that undocumented immigrants are filling up emergency rooms and driving up wait times. He claimed that this amounted to taxpayer-funded healthcare for people who aren't supposed to be in the country. But the numbers tell a very different story. According to new data from KFF, only about 0.4%, less than half of 1%, of emergency Medicaid spending in 2023 went toward undocumented immigrants. This is not a major burden on the system. It's not new. And again, it's the direct result of long-standing federal law, a law that Republicans have historically supported.
If you're an American citizen, you've been to a hospital in the last few years, you probably noticed that wait times are especially large, and very often somebody who's there in the emergency room waiting is an illegal alien, very often a person who can't even speak English. Why do those people get healthcare benefits at hospitals paid for by American citizens? The answer is a decision made by the Biden administration that the Trump administration, working with congressional Republicans, undid. We turned off that money spigot to healthcare funding for illegal aliens. The Democrats, in their legislative text, want to turn it back on.
Vance also tried to make the case that some migrants who have been granted temporary legal status, including asylum seekers, should be treated as illegal aliens. His argument is that the Biden administration has been too lenient in granting legal protections. But whether Republicans like it or not, people who are granted legal status under US law are not considered undocumented. If Republicans believe those individuals shouldn't have legal protections, they can try to change the law, but that's not the current reality. Labeling people as illegal when the law says otherwise doesn't change the facts. Speaker Mike Johnson echoed Vance's claims, accusing Biden of using executive orders to give health benefits to illegal immigrants. But again, there's no evidence that undocumented individuals are now eligible for Medicaid or Obamacare due to Biden's actions. What has changed is that certain groups with temporary protections, people legally allowed to be in the country, can qualify for coverage. Whether Republicans agree with those protections or not, they are still legal under current law. Meanwhile, Republicans have also been criticizing blue states like California for using budget tactics to shift federal Medicaid funds toward healthcare programs that benefit undocumented residents. The Biden administration denies this. And more importantly, even Trump's own legislative agenda didn't include a clear penalty for doing so. A provision that would have punished states for these supposed gimmicks was stripped from Trump's own bill earlier this year. Polls suggest the Republican argument may not be landing. A new KFF poll shows that 78% of Americans, including 57% of MAGA Republicans, support extending Obamacare subsidies. Another poll from the Washington Post shows that more Americans blame Republicans than Democrats for the shutdown, despite the fact that Democrats are rejecting a clean funding bill. So what's really happening here? Republicans are trying to change the subject. They're trying to steer public attention away from a very popular healthcare proposal, one that would help millions of Americans afford coverage, and instead focus on immigration, where they believe they have stronger political ground. But the facts don't match the rhetoric. Undocumented immigrants are not getting full government healthcare under this proposal. Emergency treatment is legally required, has been for decades, and represents a fraction of federal spending. And the larger debate isn't about migrants at all. It's about keeping the government open and how to pay for basic health services for the American people. In the end, this fight isn't really about policy. It's about messaging. It's about winning the headlines and shaping public opinion. But while politicians argue, the government remains on the brink of shutdown, millions of Americans face uncertainty, and the facts are getting lost in the noise.